are new on my channel, can you give a little introduction?
So I'm Anjali and I'm Sejal's mom, and I'm also a doctor. I'm a gynecologist. I'm the director of obstetrics and gynecology department at Artemis Hospital, Gurgaon. Plus I also have my own clinic.
She's a really good doctor. She has been on my channel many times before. The reason that we're doing this video today is because we did a video about 9 months back about questions every girl wants to ask the gynecologist. That video is the most viewed video on this channel, and a lot of people, interestingly enough, even boys told me that that was a very helpful video. I thought, in fact, it's my mom's idea, like we thought of it on a flight together, that we should start a series called Mom and Me, in which we're going to answer a lot of these kind of questions, and because she is a gynecologist, we should make use of that and talk openly about such topics. So I'm going to start off with today's topic, which is myths about contraception and basic questions about contraception that all young girls and boys as well have.
So the idea of this video is, let's talk.
So as always, if you guys find this video helpful, make sure you guys hit the subscribe button and also the bell button, because you don't want to miss out on any of my further videos. I'm going to be doing many more videos with my mom. Make sure you follow me on my social media as well for updates, and let's get started.
As a gynecologist, I have seen a lot of people come to me, and actually many people are really ignorant about all these things. And unless and until you ask, you are not going to land anywhere. And remember, just Google is not the answer. Facts should come from the right source. Yes, I am going to be interviewed again by my daughter.
So are we ready?
Yes, let's start. Okay.
What is the best method for contraception?
The answer to this question is not that simple. Ideally, there is no best contraceptive. The contraceptive advice which we give to a person is always based upon their individual history, their individual requirements and their age, and lots of factors. All contraceptive methods have their own advantages, disadvantages, success rates, failure rates, and you all need to be aware of different methods which are available to you, and then of course take your own pick. But yes, definitely always after consulting the doctor.
Next question. So what is the best contraceptive for a young couple?
We have to give them a lot of options. You know, they can use a barrier method, they can use a hormonal contraceptive method, they can use an IUCD. But one of the commonly used method is oral contraceptive pill.
A lot of people don't know what the right method is. For a lot of people don't even know if there is a right method to use a pill.
Yes, absolutely. These are hormonal pills. Basically, they are a combination of a hormone called estrogen and progesterone. And how they work is they inhibit the ovulation and also make the lining of the uterus not favorable for the implantation of the eggs. They need to be taken regularly. Remember, they are not emergency pills, which means they are not supposed to be taken just after unprotected intercourse. So most of the pills which are available in the market are usually 21 days pill. It has to be started from the first day of the period. From that day onwards, you are supposed to take a pill every day. Remember, every day, irrespective of whether there is an intercourse or no intercourse, preferably at a fixed time. And remember, you're not supposed to miss a tablet, because if you miss a tablet, the contraceptive efficacy of the pill does not remain 100%. So how it is done is that you take a pill every day for 21 days, then you're supposed to give a gap of 7 days, and in those 7 days you will automatically have your next period, and then 8th day you have to start a new pack, irrespective of whether your period has stopped or not. So it's actually like 21 days on, 7 days off, 21 days on, 7 days off. What happens if you miss a pill? If you recoup the pill within 12 hours, then the contraceptive efficacy is maintained. While if the pill-free interval is more than 24 hours, then you need to use a backup option for the contraception. Then the contraceptive efficacy of the packet no longer remains 100%.
I have heard from many friends and just random things on the internet that these pills have a lot of side effects, and some people talk about you start gaining a lot of weight.
Yeah, first of all, for all of you, I would say that hormones are not bad. Somehow, people think that they could be causing some side effects, but in my opinion, they are one of the best methods of contraceptive choices which are available to people. They are very effective. Their failure rate is only 0.3% provided if they are taken regularly. So it's one of the very, very safe method of contraception. So when a gynecologist actually prescribes a pill, she takes into account a lot of factors like your personal history, your family history, your medical history. So a lot of thought goes in before you actually get a prescription for the pill. And that also means that before you actually start a pill, you must visit a doctor so that the right kind of pill can be prescribed to you. And yes, it's a myth that it can cause weight gain. Yes, in some cases, some people experience a little bit of nausea, a little bit of vomiting, a little bit of water retention, and maybe a slight weight gain. But it is, the benefits of taking a pill, they far outweigh any kind of these minor discomforts which a woman may face while taking a pill.
Sorts of advertisement about emergency contraceptive pills. So can you explain a little bit more about that?
Emergency contraceptive pills are, as the name suggests, are meant for emergency only. And they are not supposed to be taken as a regular contraceptive pill. It has to be taken immediately after the unprotected sexual act, and it doesn't really work after 72 hours, and in many cases, even if it is taken within the stipulated time, it can fail also. So even if you've taken a pill and you miss a period, it's very important to be aware that this pill can fail and you're supposed to do a pregnancy test.
So but what is an abortion pill then?
Is when the pregnancy has occurred and it's an unwanted pregnancy, and now you want to terminate it. Now remember, all of you, abortion pills are not to be taken over counter. So you are supposed to go to a doctor. The doctor will try to ascertain what is the size of the pregnancy, what is the location of the pregnancy. Because for example, in case the pregnancy is in the tube, or if the pregnancy is more than a stipulated time, then these drugs can actually cause such severe complications which can be dangerous to a woman's life. I'm again repeating, dangerous to a woman's life. So never take an abortion pill on your own over the counter. Always remember, you need to go to a doctor before you take a pill. This is very, very important.
Go to a doctor.
Yes.
I'm getting a little scared now as the video is progressing. A lot of my friends and a lot of people I've heard who have PCOD take contraceptive pills.
These pills are also known to have a lot of non-contraceptive benefits. Even for someone who is not desiring any kind of a contraceptive cover, we use these contraceptive pills as a treatment for various diseases. For example, PCOD you said, also people who have endometriosis, also people who have heavy periods, also people who have painful periods. But yes,
doctor,
the pill, yes, the pill, these are things which are never to be taken over the counter or after Googling. Yes, yeah. I know there is a lot of information available. In my OPD, I'm always constantly in competition with Dr. Google.
This is the last question. Mama, can every kind of person use these pills? Because every body is different. Everybody, like you said, is everybody eligible?
Yeah. By and large, these pills are pretty safe, and like I said, there are different types of pills available having different kinds of combinations of hormones. But yes, there are some people wherein taking a regular pill is not a very good idea. Somebody who's, let's say, is in a higher age category, we always have little bit of restriction when we advise them a pill. Now, for all those people who smoke, especially if you're smoking more than 10 cigarettes a day, pill is not a very good idea. Now, somebody who has a history of cardiovascular disease in their family and is not a very good candidate. somebody who's got serious liver disorders like liver failure, cirrhosis, they're also not very good candidates for the pill. But like I again said, please do not attempt to take a pill, especially if you're suffering from all these problems.
And I know the video must be very long by now, but I just want to share a personal chota experience which I always tell all my friends also. You know, there are so many stories you hear ki if something happens, people just go straight to a doctor without telling their parents. But you know, you won't realize it now, but your parents aren't as scary as they seem. I mean, you would feel like what they'll do to you if you go to them with something you're not proud of, but they'll at max, you know, give you a slap, threaten you to chuck you out of your house, but at the end of the day, they're going to find a way to get you out of that problem more than anyone else.
Like I always tell all my patients that pregnancy should always happen by choice, never by chance. So remember that.
So I think we'll conclude the video here. There's going to be a part 2 to this video definitely, where we're going to talk about, it'll be a contraception, more
Other
information
methods.
about, yeah, part 2. Okay, thank you guys for watching. Please subscribe and comment below. Give this video a thumbs up and share it with your friends, anyone who needs this video, and we'll see you next time.
Bye bye.